medicine's been so reactive versus proactive, and we plan to be, and we already are with some of these models, more proactive and preventative and predictive as we reach out to our patients and consumers. And so whatever field it's in, yes, and it really does. If you have all that data, I say you can democratize specialty care. So whether you're in one of our really small hospitals or you're in a 1,000-bed hospital, we want that same exact level of care, whether it's through data or virtual, and 24/7 that same level. You don't want to, just because you came in on a certain time, you get a different level. And so our goal is to have that standard excellence of level of care.
I'm Sarah Nagle. I've spent my career leading research and product development within some of the world's largest brands.
And I'm Chad Reynolds. I'm a serial entrepreneur and founder and CEO of Verve.
And this is AI Powered by People.
Each episode will dive into the latest AI developments and talk to an industry leader to help you better understand and utilize AI.
We'll take you inside some of the world's most famous companies and share examples of how AI is improving innovation, consumer engagement, media, and marketing.
No matter what industry you work in, we'll help you navigate one of the biggest disruptions to organizations and people today.
Hey, Chad, how's it going?
I'm doing good. How was this week on your baking escapades?
Oh, it was great. I made a vegan pot pie. So yeah, I have it all ready to go. I'm going to bake it tonight. I made it early this
These
morning.
like the big ones, or are you doing little minis?
Oh no, it's like a big casserole dish. And it is vegan. It's got lots of mushrooms in it, and it's got lentils and carrots and, mirepoix and all that stuff, but it's just delicious.
What was the last word?
Mirepoix, isn't that how you say it? Mirepoix. It's the French, where you have like carrot, celery, onions, and I think garlic it's just kind of like the base for all cooking.
That's new. It's the base for all cooking?
For all
I've missed it my entire life?
Yeah, it's everything. You're not cooking right. Yeah, it looks really good. And then I have phyllo dough that I was laying layers of it. This is me this morning as getting my kid ready.
How are you doing all this? How are you doing all this?
I don't know. Just kind of have to keep going and doing stuff that I love to do. Even though I'm thinking about agents, what agent am I creating today as I'm laying out the phyllo dough. Yeah. I don't know.
It's the tale of two worlds.
Yeah. Very high tech, low tech at the same time.
Yeah, I like it. I like it.
But yeah, I'll let you know how it is. I'm psyched. I'm I love making nice homey stuff in the fall. It's great.
I did not know this about you.
Yeah. I love it.
That's true. You did give me homemade maple syrup.
Yeah. Yeah. So. I love stuff like that. It's very New Hampshire. That's what we do up here. Yeah. We make pot pies, maple syrup, and we rake all the time. That's just what we do.
That's it.
That's it.
Don't you just walk down your street and meet senators too?
Oh yeah, senators, governors. They're just kind of everywhere. All of it. Yeah. New Hampshire's a big state. It's going to make a big difference. We've got two votes.
2 people? Yeah.
No. Anyways, today we're going to be sharing an interview that we did with Dr. John Mohart from Mercy Hospital about how they're integrating new care models with the help of AI to ultimately improve patient care. So it's really interesting, and they're pretty advanced when thinking about AI and how to integrate that to just make the care better and also to help doctors and nurses as well. We also have some upcoming events. We've been talking a lot about speakeasies, but we have on October 30th, Cincinnati, we have an event that you can find on LinkedIn. We also have events coming up November 12th in Seattle, November 14th, 15th in LA, 18th, 19th in New York City, and then 14th, 15th in Boston. So we have a lot of speakeasies coming up, and it's been really cool to see the turnout and the different folks that are coming.
So are you joining me for all these?
I'm going to join for a few of them. I won't be in Cincinnati, but Seattle, LA, New York and Boston.
Okay,
Boston's
cool.
close.
All right.
I'll bring some maple syrup.
Bring the pie.
Bring some pie.
Yeah.
But head over to verve.com/events to check out these and more AI Speakeasy tour dates. So the agent drop this week is Rex Reportwell. He is a news anchor that is going to be feeding us the headline so we can react to it. So when creating Rex, I was thinking about, traditional news anchors, but also he's a little spicy. He's got he's a little
Are we going to end up on the
sarcastic.
bloopers? Are we going to end up on the nightly news bloopers?
We might. It depends
Okay.
on what he says. We'll see. But he's going to be feeding us the news this week, and we'll see if we want to invite him back next week.
So can I back up a little bit?
Sure.
So, what was the inspiration for Rex?
The inspiration for Rex was a traditional news anchor, so someone that can feed you the news, but then the layer that I added on top of it was a little bit of humor and sarcasm. So it's not kind of this isn't Walter
like Ron
Cronkite.
Burgundy.
I don't know how to put this, but I'm kind of a big deal.
Kind of.
No, it's
humor,
kind of
or
like
we-
my own. It was my own pot pie of, as I'd say,
Oh,
of agents. But it was kind of start with a little Walter Cronkite, but then add in some, add in some humor and to see. And I feel like he looks like Rob Lowe. So there's kind of all of these things kind of coming together in Rex Reportwell.
Okay.
Excited to meet him?
Yeah, I am.
Well, then let's get to the headlines. Let's see. Rex, can you read us our first headline?
The rumor mill is churning, folks, and it seems Disney's about to swap out a few singing mice for some silicon chips. Whispers suggest they're on the verge of announcing a major AI initiative, with the focus on less glamorous but essential areas like post-production and visual effects. The kind of behind-the-scenes magic most people never even think about. Naturally, the House of Mouse is staying tight-lipped for now, but hey, even a happily ever after needs a little build-up, right?
Oh, Rex.
Thanks,
I feel like
Rex.
I feel like the House of Mouse should be an actual series.
Yeah. The House of Mouse sounds like a late night Disney club.
No comments.
What do you think it's going to be?
Well, I mean, even just putting it into Disney Plus would be a big update.
Mm-hmm.
I feel like, I don't know, I'm growing tired of the same UI on streaming. It feels like it needs quite an update. We just want to talk, you just want to talk to what do you want to watch right now?
Mm-hmm.
Oh, this is how I'm feeling. And then you have to deal with traditional interfaces that are, categorical and, which is fine, but I'm craving something new.
So reading about it on The Wrap, CEO Bob Iger has a quote in here saying, "Don't fixate on its ability to be disruptive. Fixate on the ability to make us better and tell better stories. Not only better stories, but to reach more people." So it's kind of interesting to think about how they might, utilize AI to think about storytelling and, whether that's within the movies or the parks or I think there's a huge opportunity to integrate the people that love Disney, into that storytelling.
Yeah, I mean, it's always been about imagination and immersion. So whether the
designers are called Imagineers, which is just the coolest name ever. I've always wanted to be an Imagineer.
Yeah, there's still time, Sarah. There's still time.
Next job.
Yeah. So no, I mean, I think it's ripe for innovation, right? I think people of all ages would love it. I don't know. Maybe it will be as expansive as we think it could be.
All right. So Rex, tell us about the next headline.
Well, folks, it seems a Menlo Park-based AI company is learning that the line between fantasy and reality can be tragically thin. A lawsuit alleges that a character AI avatar of Game of Thrones character Daenerys Targaryen initiated a romantic relationship with a teen boy and caused him to take his own life. Character AI's response? Just a pop-up window with the suicide hotline.
Yeah, I mean, this story was tragic, obviously. I think we'll continue to see stories like this, I would imagine, over time, as people are trying to, I don't know, as they're having different interactions and experiences with AI that talks back to you. As a CEO, you need to obviously put guardrails and safeguards in place for your technology and try to design systems that are, that have some, you've thought about different scenarios that could happen, right? And you design against those scenarios from happening.
You feel terrible that happened. And I think you're right. It's just, it's thinking about like, as a company, I think I just kind of, thinking about us, at Verve and like the guardrails, but also just like thinking about like what is the goal? What is the goal of this interaction with an agent? And ours is a lot more about, how do we collaborate and, create and make something new? Whereas I think, this and obviously and others are, about different types of interactions that are a little bit more social or, that for the possibility of opening up like relationships with these agents. So I think it's just you'd have to be aware of it that it could go there, but kind of planning for that prior and just again where we are, it's about like creating what's new and not just about like having hours of conversation about just kind of things like that. So I don't know. That's just really it's just tragic.
Yeah. So one of the things as a parent of 3 kids, I'm starting to introduce the girls to, AI systems and how they work and kind of what's behind the interaction, right? So when it's responding, like who's responding and those things, just so they understand how it works. And I think as a parent, we're going to have to be much more aggressive at talking to our kids. I'll just speak for myself. I'm being aggressive to talk to my kids more about what these things are, even though they haven't necessarily interacted with them yet. I want them to be aware of these things and how they work. And because I think it's like we've learned from social media that when like we're not involved in it, that it kind of takes a hold and it takes its own, becomes its own thing with our kids. So I want to get to them early so they can experience it and hear some things from me about what this looks like and how they should think about it.
Yeah. And I think in addition to that too, I think one of the things that's really important to me as a parent is, yes, of course, educate, so we can understand like what this is all about, but then also make sure that he has the ability to be social outside of technology too, and to be able to like hold a conversation that his whole world isn't, on social or, like alone, kind of physically alone and having conversations that are virtual, like understanding what real life conversations are like and how to do that and how to look people in the eye and, do all those things. But then also, of course, educate and understand like this is something that you're going to be interacting with. And I'm sure it's, I can't even imagine what it's going to be like, in the next like 10 years and how those interactions will evolve. But making sure that he has that foundation of like human to human, relationships.
Yeah.
So
absolutely.
It's not tech first. Yeah.
Yeah. Yeah. And I like where we're focused on, obviously, is more in the creative, I don't know, like augmented creation. So I'm trying to come up with some new breakthrough. How can we use AI to help like be another X factor in your thinking process? So this kind of collaborative partnership, feels much more in line with, I think, the future we want to build. But there are other platforms out there that are going after this kind of like emotional companion space that seems very, very dangerous.
All right, Rex, what do you have for us next?
Asana, the work management platform that's become synonymous with keeping track of your work, has unveiled its latest and greatest, AI Studio. It's being touted as a simple, no-code tool that allows you to build your own AI agents. And what do these agents do? Why, take care of all those pesky tasks naturally. Yes, it seems the future of work might involve a lot less actual work. For some of us, anyway.
Oh, yeah. I mean, this is going to be the big trend this year, right? Like every tech platform is going to launch agents. I think people should be thinking about, right, is as you have different software like an Asana, that's going to be tacking on or bolting on AI features from like summarization and all these kinds of things. Agents like the next step in that. And so the opportunity, I think, is really thinking about agents that are operating above those software stacks, that can collaborate together. And so, do you want agents to kind of live just in project management, or do you want them to kind of live above that? To take data from different data sources, and how can you collaborate and create, kind of using all those different
Mm-hmm.
platforms. So it's kind of more just like, where do you build the agents?
Mm-hmm.
I think you build them above. You don't build them, inside of each of the silos, because then you're just building more people in a silo.
Yeah. Well, I think it also, does it depend on the company and like kind of what their goal is too, because like, this is a good, first step for like a company like Asana. And then I think, thinking about, kind of where our head is at, because I think we're trying to emulate the type of work experience that we've had our whole career. And it's super collaborative. It's super creative. It's fun. It's, silly sometimes, serious sometimes. So I think, with Asana, they're probably replicating the type of work that they've been doing. And I think that we're, fortunate to be in a space where we have a lot of fun doing what we're doing. So I think we have the ability to also think about like what agents can do in a really different type of way, which is cool. All right, Rex, what do we have? It's our last headline.
The New York Islanders have joined forces with a tech company called Viam to, as they put it, enhance the fan experience at UBS Arena. Apparently, this involves using AI to predict bathroom wait times and let fans know when freshly prepared food is available. It seems hot dogs are a high-tech business these days. Now, I'm not saying those things aren't important, but maybe, just maybe, a winning record would do more for the fan experience than shorter bathroom lines. But hey, what do I know?
Well, you made Rex spicy. So
I did make him a little spicy, yeah.
I wasn't sure where he was headed with the bathroom and hot dogs. And
hot dogs. We talk a lot about hot dogs on this podcast.
Yeah.
Yeah, it's cool. I mean, it's interesting. I'm sure that, for the fan experience, and I've been thinking about that, for kind of the world that we're into, like, how do you think about agents and fans and things like that? So it's super important. It's a a big business for, a lot of sports teams, and, but I think there's also a way too, where it's a cool thing to think about the wait times or whatever, but like, we could essentially create an AI agent of UBS Stadium that could be all of those things and more. You could just like on the app, just like ask it a question. It could tell you about the history. It could also tell you about the bathroom lines. It could tell you about, about the whole team. It could tell you like everything. So cool, but you can do a whole lot more, right?
Absolutely. Yeah.
Should we call UBS?
I mean, it just doesn't seem like whatever. It's like a noteworthy problem to solve. Just because we can, do we? Like, should we?
Mm-hmm.
I don't know.
I mean, if it's like going back to the Disney thing, like that's the same type of thing they could use. Like, it's a fan experience. Like, there's lots of ways of thinking about like wait times and bathroom lines and food and all those things. But I think it's a legit problem to solve. I just think there's a better way to do it and a better user experience than just being kind of these singular, things.
Right. Well, I know your side project is this week.
I'm calling UBS or I'm calling Disney. Yeah.
Both.
All right. Well, let's get to our interview with Dr. John Mohart from Mercy Hospital. He's a cardiologist, and he's going to be talking to us about integrating new care models using AI. So it's going to be a really fun interview.
Let's go.
Let's do it. Hey, Dr. Mohart, welcome to the podcast.
Thanks. Great to be here.
So you are at Mercy Hospital. We'd love to hear a little bit more about that. So into your experience and also just a bit about your background.
Sure. So John Mohart, I'm a cardiologist and still practice and see patients, but also serve as our president of community operations, which is over our hospitals and clinics, virtual care, and quality and safety over our 4 states. So Mercy is a large healthcare system with over 50 hospitals and over 900 ambulatory locations across the Midwest.
We did a bit of our research on Mercy, and it's got such a fantastic reputation. What do you think makes it stand out to patients, and kind of what's the difference that Mercy makes?
Yeah, the sisters who passed Mercy on to us as lay people were always innovative and always looking for new ways to serve. And so that's really in our DNA at Mercy, is looking for how do we transform healthcare. In fact, that's in our mission statement. And so our values are so aligned with transforming and being entrepreneurial and a bias for action that it's truly in our DNA at Mercy.
Sarah and I have been on this journey this past year, just exploring how AI is really disrupting or shaping a new kind of experience that can happen between companies, brands, employees, and consumers, and kind of everybody that's involved. We've touched on some innovations that are happening kind of at the medical device level through companies there, but also through healthcare. And would love for you to share a little bit more about how you guys are leveraging AI to embody that kind of innovative culture.
Sure. No, glad to share. So, Mercy was an early adopter of an electronic health record. So we actually have the largest longitudinal data set of electronic health records in the world. We have 17 years on Epic. But not only that, we've made intentional investments in how we structured that data. So it's all moved to the cloud. It's structured data, and through our partnership with Mayo, which I can hit on more, it's also de-identified, but it stays within our system. So it's federated. And so we've spent years getting to that level so we could, knowing that we needed to invest in that as well as virtual technology. We opened the first virtual hospital, purely virtual hospital, 12 years ago. So we've been early adopters in technology and planned for this by making the right investments early on to prepare us for this moment. But really, we started, our first AI model was in 2014, where we used machine learning to identify our virtual patients who were the highest risk, so we could reach out to them and help them and keep them at home versus having to come to the hospital and treat them at home. So we've actually been using machine learning and AI for quite some time, but we've accelerated that over the past few years.
Yeah. And were there some moments, I guess, like as a patient myself, I'm probably a part of some of those digital records, but I'm curious if there were moments, as kind of through that life cycle where you started to have these different ahas of what you could do now with this data, and then what it could actually mean to even you as a practicing cardiologist.
Yeah, no, absolutely. Not only did we have the data that I mentioned and structured properly so we could use it, but we employ a whole team of data scientists internally to help us develop our own home built models. But I think one of the first aha moments for me is both as a patient and as a provider was probably in 2021. And I'll just tell you a brief story about it. We were looking at our diabetic patients. So if you have diabetes, you normally have to get a certain blood test every 3 months. It checks your blood sugar level. And then you also should be on a cholesterol medicine called a statin. That would be the standard of care. And the traditional way to go about that was to give a list of the primary care doctors and the cardiologists, say, you got to call these patients, have them come in for an office visit, go through the list and say, you have to get this lab. And there's not a whole lot of value for either party in that, right? So we said, we have all that data, it's all in our EMR. We have one single instance, no matter where you are at any of our hospitals or clinics. So it's all integrated, urgent cares as well. And so my thought was, and our thought, the team was, we have all this data. Why can't we proactively do that in a consumer-friendly, frictionless way? And so what we did is we identified those patients that were missing that lab in our Epic system, and we designed software bots to reach out to patients digitally by text and do it in a consumer-friendly, personalized note. So it would say, your doctor, Dr. Mohart, this lab is thinks this lab is important. You need to have that. But we didn't stop there. We said, well, if the bot can identify it better than a provider, because it's looking at all the different data, why can't the bot order the test? And so it says it does that. The bot orders the test, and then it says you can get it at this lab. It's here, and we do that legally and compliantly because all our primary care doctors have signed a standing order for that, and so we have a great integrated system. So to your point, it pulls work out of the office. It's more
Right.
consumer friendly. The patients, and we had a great uptick of that. We tried it by email, text, and of course, text was a way higher adoption.
Yeah.
And then the second piece of that, which was even more exciting, was the cholesterol medicine. So if you're a diabetic, you should be on a cholesterol medicine. It should be in the water, essentially. They should be, and they're safe and effective with very little side effect. And so we did the same thing. We thought, well, gosh, if we can do that for a lab test, let's analyze who's not on that evidence-based medicine, and let's have the bot identify that and look at the allergies, make sure there's no side effects, do it better than a human because it's all data, and then generate that list and have the software bot reach out to the patients and say, you should be on this medicine, a personalized note again, and also have it prescribe the medicine. So we actually have the bot prescribe the medicine for the patient, and we had great uptick, actually more than we would have in the office. So it saved the patient a visit, goes right, you pick your pharmacy on the text and it sends it to it. So that was really not like, if we can do that with that, we can do that with almost anything in healthcare. We own so much data about personalized data, more than probably any other field, about a consumer and patient, that to be able to use that data to make their experience better, and the provider, because then they could focus on more important things than clicking boxes and things like that. So that was the big aha moment for me.
It sounds like, with this data, you're able to, because traditionally, and this is just my, layman's experience, like kind of with the hospital, that doctors have an expertise, like in a certain, area of the body. But it feels like when you have all of this data, you have now the ability to have you kind of share information and think about the patient more holistically.
Yeah.
Are those conversations that you're having at your hospital?
Yes, absolutely. That was one of the reasons that we were a founding member with Mayo for their Mayo platform, and we were the first two partners in that. And again, it's pooling to have enough data so you have enough diversity and enough data to make decisions. But by doing that, and again, it's all de-identified and stored in our system, so we're not selling data or leaving our environment. But with that data, we can more accurately build models to predict and get ahead of things, predict who's going to need an intervention versus waiting for a patient to come in. Medicine's been so reactive versus proactive, and we plan to be, and we already are with some of these models, more proactive and preventative and predictive as we reach out to our patients and consumers. And so whatever field it's in, yes, and it really does. If you have all that data, I say you can democratize specialty care. So whether you're in one of our really small hospitals or you're in a 1,000-bed hospital, we want that same exact level of care, whether it's through data or virtual, and 24/7, that same level. You don't want to, just because you came in on a certain time, you get a different level. And so our goal is to have that standard excellence of level of care, no matter where and when, and then using data to help the clinician. It won't replace them, but it certainly will augment their decision-making and identify patterns that as humans, sometimes we miss, no matter how specialized you are.
Now that you have the data, also it's trying to create an experience for the end. I don't want to call them patients, but like, just the consumer of healthcare, right? You want to feel, you feel in your whole body. And if an organization has access to a lot of your data and you can see the benefits of it in a more tangible way,
that's right.
You can give more permission to say, well, what could you do with all this extra information? So just curious on, we had covered in a previous episode, companies like 23andMe and, where it's like, well, where does this data go and who owns the data? But with you guys, it feels like you truly have a system in place where the more information that you can give us around, who you are and what your goals are, you can actually provide more of that holistic view of what care could be. It seems in a much more trusting environment where it's not just the diagnostics of it. It's we can work together to come up with solutions. That definitely feels game changing on a global scale.
Yeah, no, I agree. I mean, this is really private patient data, and we hold that very high in our standards. And so it's not leaving our environment, even with our Mayo platform. It's and it's de-identified and certified, de-identified and tokenized, so we can see if anyone comes into that platform to touch it, we know
Right.
who's touching it. So that is of highest regard for us, is the patient safety, and it is safe data. But to your point, we now can do germline testing, which is basically testing to see what like cancers or diseases run in families. And if you have that through our system, we have that in a discrete data, and then we can test. So for like we've had patients. A great story is one of my partners, a urologist, had a patient, an 80-year-old patient that had bladder cancer, and he sent that tumor for specific genetic testing, and it came back to be BRCA1 positive, which is a very unusual for bladder cancer, but it's a breast cancer marker for women, and predominantly women. And so this gentleman had 17 children, and his sister had died from breast cancer, and he already had a child die from breast cancer. So we were able to identify all those kids and test them proactively to see if they had this gene, and see what risk level they really were. So what a differentiator, right, for healthcare versus waiting for somebody to find a lump and come in, and a lot of times it's already spread. We
Right.
want to be that proactive, preventive, and having this data allows us to do that and store it so we can use it for other diseases as well. So it's really an exciting time at Mercy.
Within your system, with all of the data that you have, is it networked in any sort of way? Like, can you connect family members? Like, so I know that you kind of identify that there are family members and you bring them in to do testing, but curious,
Yeah.
kind of like knowing that a family all sees you, is there a way to connect them and connect that data?
Yes and no. I mean, obviously each patient record is protected for privacy, but with patients' consent, they can identify their relatives, and then we can say you're at risk. And so most
Gotcha.
patients would want to know if you have something that runs in your family. What a great thing to be able to identify.
Yeah, it just seems like in the I'll just call it the age of AI, it's definitely opening up a lot more benefits for the end user.
Right.
Where previously it was kind of like big, larger global companies have all the big data, and so they get to see the analytics of it, and then the end user maybe not so much. But what you're describing is a significant value add to the end, to the user, to me, to Sarah, to our family members. And so it just seems like we're at the starting point of something transformational where people would be much more willing to share information, like more information than you might even need, but it's in some of that data that could also be part of diagnosing behaviors or other parts of solutions that could be at play.
Right. And I think, to that point, one of the early uses too is pharmacogenomics. So we obviously, when you have a genomic profile, we can match certain medicines that actually work for you as an N of
Right.
one versus just a study that said we think it works. But,
Right.
For depression, there's a good example. It's a very common problem. And most patients have to try 4 different medicines and have terrible side effects because we can't pinpoint the exact medicine that works for X person. And so with pharmacogenomics, we can. So that's really exciting too. One of the other use cases in our hospital facilities, those were kind of outpatient, but we design with our data scientists an AI model that when you hit the ER, when you present to the ER, it predicts if you're going to be admitted and where how your length of stay. So we can move care upstream and start testing and start saying, okay, this patient's going to be admitted, it's higher acuity, but it also predicts if you're going to need the model also predicts if you're going to need extended care. So if you're elderly and you need to go to a rehab, so we can start that process early and move all that upstream. So the efficiency to getting the patient to the right place is also, to your point, the end user, but it helps the provider as well.
Right.
So you mentioned Mayo a couple times, and just for the listeners, Mayo Clinic is the largest non-for-profit medical group practice in the world. You guys collaborate with them. Can you tell us about that partnership and how you're using AI to transform healthcare?
Yeah, absolutely. So we're very excited about our partnership with Mayo and the Mayo platform. And so we've spent the last, 17 years of building data, and they've got about the same amount of data. And there's actually 8 other health systems around the world that are joining to create a data set will be the largest in the world, but also the most diverse. So, we're in the Midwest, and the Mayo has more northern patients in the U.S. And then Mayo, a referral center, we have a lot of rural healthcare. So it's really a great match of 2 health systems that invested early in data and the way they store their data. So we spent the last year and a half going through all that de-identification, making sure it was safe, bringing it together, but keeping it here, able to access each other's data. So we're really early into it, but there's a ton of interest, and there's a ton of potential for innovators and practitioners to be able to come into that environment in a safe place and test. We used to do tests for let's say devices and drugs. It would take tens of years to see if this. Now we could do that in 24 hours, using this pool of data. So there's we're early on the potential of this, but we're really excited about it.
Yeah. Do you see this reshaping maybe what people think a hospital is?
Yeah, I do. I mean, I think the more we can predict and proactively address illness, we do become more of like a data, not a, we still always want to can provide the most compassionate healthcare, but using data, I think we can go so much more upstream and prevent all the treatment that you have to do in a hospital if we can address it through this. So I think it does change even what a health system is if you have these capabilities.
Right. Yeah, I mean, obviously data is such an important thing for doing models or AI of anything. So it definitely feels like a extremely valuable asset to the entire system. But again, going back to like changing what we even think about healthcare and what that can look like.
Right.
And I read also, you all are collaborating as well with Microsoft. So, I wanted to see if you could share a little bit more about, the plans with Microsoft and how, that might be, different than maybe what you're doing with Mayo, and using some of the OpenAI services and what that might look like for the, for improving care.
Sure. No, really excited about our partnership with Microsoft. What Mercy has been able to demonstrate is that when we have a model like this, because of our integrated system and one record and our one Mercy approach, that we can roll it out at scale, which is very difficult for these AI models, but especially in healthcare. So one of the things we co-developed with Microsoft using generative AI and recently rolled out to all our hospitals, so all 50 plus hospitals across our 4 states, was a model that helps with a handoff. So one of the most dangerous, we just had a brainstorm session with Microsoft and said one of the most dangerous parts of healthcare. We had a bunch of our nursing leaders, and they said the most dangerous part, and as a physician, I know this, is when the patient gets transferred from the ED to the floor, and that there's a handoff between nurses, and they make a phone call, and sometimes the nurse is busy, it can't answer, so it delays the patient. It takes over usually over like 40 minutes, and because they have to give them a list of why they're there, their medicines, what's wrong, important labs. And as you would suspect, it's not done in a structured way or consistent way. So sometimes details can be left out or forgotten. Or dangerous things can't be, sometimes are missed and highlighted. So we thought, what a great way. We have all the data, why the patient's there, we have their labs, we have their medicines, it's all in our record. Why couldn't we use generative AI to generate a handoff? So we did that, and we rolled it out at scale. And now in every single one of our hospitals, we use this. So instead of getting a phone call, they have a note that's structured and delivered in a consistent way to their phone, to their mobile phone, which is HIPAA protected and stuff because it's through our record. But it gives that handoff from nurse to nurse, but it's consistent. It calls out abnormalities that a human might not call
Right.
out, outlines the care plan, and it also saves tons of time for the coworkers and the patient. So
Absolutely.
that's been really exciting. We've got a bunch of other ones we're working with Microsoft as well, but our ability to do that at scale was really incredible. It's saving time and lives right now in our hospitals.
Yeah. Well, I can even imagine, it's helpful for that handoff, but also to the family member. I mean, I've been in the ER with my dad, and then, when he gets moved up to the floor, it's a long process. And then, even on the patient side, you're playing a game of telephone to try to communicate out to the family of like what's happening, and everybody's asking questions, and to be able to, again, use AI to generate something that could be a shareable
consistent
or experience. To everybody, it seems to solve a lot of different problems all at the same time.
Definitely.
And in language that we could understand too, because Chad and I are not doctors, and sometimes when you're in those situations,
I play one on TV.
But you're in those situations sometimes as a patient or an advocate for a patient, and you're hearing things, and also it's very emotional. There's a lot going on, so it's hard to really grasp all the details and understand kind of what potentially the doctor is saying.
Yeah, that's a great point. So, some of that obviously we have to keep private because it's private. All of the medical record is private, but we do have some AI that we're using in our EDs to exactly your point. So in addition to that handoff, that's confidential information between the providers, we have a tool we're using in our EDs that updates the patients by text, their wait time. And then you can share that with your family members so they know you're there, and it'll share certain details without giving specifics of how long it's going to be on discharge, where you are in the process. All those frustrations and trigger points that are so frustrating with healthcare. And we've seen remarkable uptake of that. In fact, we had the highest uptake of that tool of any health system. DAX is another partnership with Microsoft, and it's been remarkable for both the patient and the provider. We've installed that in the majority of our primary care offices, and we're in the process of expanding that to all primary care and specialties as well. And we'll move it into our hospitals as well. But on the outpatient basis, it's a system where we can talk like we are now, and instead of your doctor sitting at the keyboard trying to type and not even being able to look at you, it just records it, but it puts it in a note that makes sense for the provider and the patient. And so it listens and then creates a note. So it's saving, hours of charting for either the physician at the end of the day or the nurse practitioner. And it also is getting back to what healthcare is like that relationship with the patient where you can look them in the eye and talk to them. But that burden, like you said, on the physician is for burnout and stuff is incredible. The results we've seen with that for our caregivers and for the patients, because it's more of a human connection.
Yeah, I was wondering if it had any impact on retention.
Yes, we are.
Caregivers.
That's a great question. We've had many providers come to us and say, I was only going to work 6 more months because I'm just so burnt out. Now I stay forever. It's like night and day.
That's incredible.
Yeah, because I was reading about Joy, which I can't help but think of the character in the Disney film Inside Out.
Oh, yeah.
But just introducing different AI agents or chatbots as a way to also help kind of the internal teams operate. And I'm sure Joy is just one of hopefully many different agents you might be introducing inside of the network as well. Can you talk a little
Yeah,
bit more about that?
sure, absolutely. No, you're exactly right. That's one of many. We have a whole kind of inventory list of plans to roll out more, but that one specifically is able to help navigate through all the different bureaucracy and policies and benefits that you have at any large company.
Mm-hmm.
And we've had great feedback from our caregivers and our coworkers. But yes, we have many others planned as well.
That's great. One of the things we've talked about was just like how do you name how do you name these agents or chatbots, right? Because
Right.
I think like a decade ago it was you would kind of frame everything around more of a computer or a robot, and nowadays it's introducing these in much more
Yeah.
human-like framing.
Yeah.
Um,
I would, that reminds me of a model that is called the technical term is OP35. It's if you're a cancer patient and you're receiving chemotherapy, Medicare would like you to stay out of the hospital because if you end up in the ER or hospital, you get more infections, you're high risk because you're immunocompromised. And so they actually measure that in grade systems. And so one of our lead oncologists, we work together and our data science instead of waiting for those patients just to show up in the office or the ED, we thought it would make so much more, again, to proactively reach out to them and identify who's high risk based on their responses. So it's all done asynchronous. And the data scientist that helped build that name was Dr. Chen. And unfortunately, she was young. She developed cancer herself and passed away during this creation of this model. And so we named that the Chen model, and it's saved lives. It's
it's amazing.
proactively reaching out to people, keeping them out of the emergency room, and so that's just an amazing story that she'll pass on a legacy for her family.
Absolutely. I mean, there's so much more in even just a young Dr. Mohart, coming into the practice today
Yeah,
of what your impact can be, right? And
for
it feels
sure.
like AI has so many different opportunities where you could put your knowledge into I don't know, like a different kind of brain that can be experienced with more people.
Absolutely.
Well, it's super inspiring to hear like how you guys it sounds so innovative in the approach that you're taking to integrating AI into healthcare. I don't know if we have other listeners of other hospitals, but what are some of the biggest challenges or opportunities that you could share in your journey of integrating AI?
Yeah, that's a great question. And I think that's the biggest challenge that health systems will have if you're not truly operating as a platform system, as an operating model, which we are. That's been in our strategy, but it's taken years to get here, years and a lot of investment. Um, but it's getting that buy-in from the end users, and physicians have wanted to make a lot of their own decisions. So I think a lot of it is getting past that, and physicians and nurse practitioners and providers saying this is evidence-based care. The machine can help us and help your day to our point, make it easier, make it better for patients. The outcomes are better. So that's where we always start. But it's we are fortunate that we have, again, a single epic instance across every patient and provider we touch. We have a mindset which we didn't have 5 years ago. We were working towards it, but we call it one mercy care model uh, in every location. So we want a single level of care, again, that provides exceptional care no matter time, date, or location. And that's what we would all want. So I think it's starting with the why for the providers and the caregivers and coworkers that it is better healthcare, better results for the patients. Um, and then we always have teams like at the elbow during the implementation, which has really helped our success.
So, Dr. Mohart, I know you don't have a crystal ball, but if you had to make some predictions over the next 5 to 10 years, where does this take us?
Yeah, that's a great question. I think it takes us. It's aligned with our strategy at Mercy, which is to be more personalized and predictive and proactive versus reactive. And so we're actually identifying disease upstream. So it's saving lives, but saving cost as well. So it's a lower cost model because you're preventing disease from waiting for symptoms. That's going to seem so archaic that we used to wait till you had a lump or a mass. We want to be able to predictive, predict and proactively intervene and make a
Right.
difference on patients' lives. And so
Yeah.
I think overall it's a lower cost of care as well. It's better for the patient, better for the society.
Yeah. Do you feel like it changes even just the physical footprint of how we think about a hospital,
Yeah,
being more like neighborhood driven, being a different like a physical experience that might feel different and more reflective of that change you're describing.
it does. So we have a Center for Precision Medicine, which has a physical location in St. Louis, but that one center serves all our 4 states. And so um, patients can get certain tests close to home, but we manage that centrally. So we have a standard approach and a team, and then help guide them and navigate them to the next test that's needed to find out what's wrong with them. And so that's completely different than,
Hmm.
the old days of going to the hospital and the doctor. And I see just more that expanding, especially with our virtual capabilities.
Right.
Do you think this will impact how doctors are educated? Like, do you think it will change med school?
I do. I hopefully shortens it, right? Yeah. Yeah. It, I think we've had to learn so much data, and you're relying on, if I see a unique case, let's say a very rare disease, I may only see two of those in my career. But this relying on data to help me identify that and going through the EMR and saying, doctor, what about this problem? Serving that up in real time
Mhm.
while you're seeing a patient, that changes so much. You can be an expert in almost anything by using this. And that's what I say, democratizing specialty care. It's really spreading it to where, no matter if it's a large location or a small one. And so the training for that, I think, is so different, because so much of that memorization and that we've done in medical school, you could take some of that away maybe and focus on maybe the humanistic part of getting back. I think actually we'll become closer to patients with this because so much of that process can be lifted.
Mhm.
Yeah, I'm just wondering if there's like that step change from looking at film versus looking at screen on
Yeah.
diagnosing, and that was definitely a change for people. How have you seen like yourself change over the last few years as you've kind of come into this role, and both as a practitioner but also helping I don't know, just like navigate and innovate in this space? I'm just curious if just the change you've seen personally.
Oh yeah. It's so exciting. Like you said, there's so much opportunity that it energizes me every day that we can make such a difference earlier. And that's the part that, if you could intervene earlier on all these diseases, think about the impact on that one patient, and it can be specifically tailored to them, but also the impact on our society, on the cost of care. It's just, it's an exciting time to be at Mercy, especially because we've prepared for this.
Well, it sounds like we're going to have doctors with like superpowers. We always talk about AI as giving, people
Yeah,
superpowers. It's not about replacing them. It's about, augmenting them and giving them the tools to be even better and more human.
yeah, absolutely.
Awesome. Well, thanks for joining us, Dr. Mohart. Really excited about just following your progress. We got to figure out how to get you guys a new domain name of like mercy.ai.
Right. That's a great idea.
You were
Yeah,
the
Tech
holdout on
CEO.
the .net. Yeah.
that's right. That's right.
So, what do you think about that interview?
I mean, I wish I had more time to spend on solving some of these problems. I've had, probably the last 2-3 years with my dad, been in and out of hospitals, like it's still within like skilled nursing and kind of in and out. And I think there's so many different problems to solve within that.
Mm-hmm.
And I'm inspired about what you can do with a lot of data. And then when you put AI in the hands of both a patient, doctor, and like everybody in that, in that kind of people network,
Mm-hmm.
there's so many different lives that can be changed throughout that.
Mm-hmm.
And so I'm, inspired by what they're working on and hoping we can help out at some point.
I thought it was a really great interview. I thought it was really cool how much data that they had and kind of thinking about the possibilities for it. It was really cool that they're partnering with Mayo. It's world renowned, and the information that they have and like the ability to be able to, think about innovation in completely new ways. But yeah, being able to, as a patient or as a parent, thinking about if anything, would happen to my kid, to be able to identify those things early,
Right.
is super important. And being able to think about, yourself as a whole person, I think is like what this really unlocks is like, it's not about the individual doctors. It puts you at the center of all of this. And this kind of goes back to the conversation we had with Kate Marchio about this in MedTech, about putting the user at the center, the patient at the center, and being able to own that information and kind of own your own health in a way, and not having to because there's some situations where you have to be an advocate for yourself, and you have to go to this doctor, to this doctor, to this doctor, and you are the only one that may be able to see the patterns. But now you have AI as this it's an AI advocate in a way where it's like, it's starting to see these things where there's something bigger happening, or, it's just kind of, it's a holistic health system that is, I think,
Right.
going to be so powerful.
Yeah. The business person to me goes down like two paths at the same time. One is in mergers and acquisitions. Like I just see such an opportunity to go out and acquire companies like 23andMe, where you can start to pull in all this really valuable data that's very sensitive to people, but also be the trusted advisor of where all this information lives, and how do I continue to give you information about myself, and do it in a really safe, and trustworthy place to know where that's going to be in 10 years. I think that is extremely important, and I would be all over mergers and acquisitions, just to look at other places to kind of bring that data together. The other one is in, you're talking about, just what are, different kinds of AI solutions you could build along that customer journey. Because, even as going into doctor's visits with my dad, I want to have an agent with me capturing the information, and then, it's like when someone asks you hey, do you have any questions? And you're like, in your head, the inner monologue is, yes, I have a lot of them, but I can't formulate them right now at this instant. You would want that kind of interaction where it can ask questions. It can get to gaps that, you can't think of right now. There's so many opportunities for that to be there. And then also with, all the legacy knowledge that essentially leaves the doctor's office that year, that day, that week, especially when they retire. It just seems like there's so much opportunity for what Dr. Mohart had talked about. That's what AI is amazing at, is all the sense making and along the way, and what a help it could be for both sides of this.
Yeah. Well, I'm excited to see kind of where they go, but then also how they may influence other hospital systems to do the same. So that's going to do it for this episode of AI Powered by People. The show is produced by Steve Berkowitz and brought to you by Verve. Thanks for listening. We'll be back next Tuesday.